The Gauteng Health Department has confirmed that it's completed post-mortems on 74 of the 77 Johannesburg Marshalltown fire victims. It also says police have drawn DNA samples from 62 bodies that were unidentifiable. Further testing will now also be conducted to link the victims to their families. The department says to date, 10 families have identified their loved ones from 12 identifiable bodies and 7 have been released for burial. Let's get you more updates on the story now. Joining us this morning is Gauteng Health Head of Communications, Motalatale Modiba. It's great to talk to you. Thanks very much, sir, for coming on. There's a lot of progress that's been made, especially insofar as post-mortems are concerned. 74 out of 77.
Indeed, there's a lot of progress. In fact, we've done all 77. You'd recall that during the week, the MEC did pronounce that the team is going to be working over the weekend to make sure that they process this, because we understand the need to move a bit faster around this particular case. So what the team did is that the 74 that was declared dead on the scene have been completed, but they also went further yesterday and did the additional 3 who demised from hospital. So all 77 people that are related to the fire incident, their post-mortem has been completed. And as you rightly said, in terms of the 62 unidentifiable bodies, the police have also moved swiftly to complete taking of the DNA samples. What now obviously needs to happen is that we need to ensure that the antemortem swabbing, which is taking samples from family members, and by family members we need to also qualify it to say it's not a distant relative, an uncle, a cousin. We're talking about siblings from the same mother. We're talking about parents in this particular instance, because that's the only way that you're going to be able to confirm, or even children. So in this instance, we're requiring families to obviously come forth. Already 13 antemortem swabbings have already taken place. We continue to call on families to come through. I think to date, 69 families have presented at the Deep Loop Forensic Pathology Mortuary to come and declare that they do have a loved one who has disappeared since the incident of the fire. Out of those 69 families that came through, about 69 names have been generated in terms of the line list. What happens is that sometimes it happens that family members from the same could come at different times to claim the same person. So obviously, when those family members come, we register them as individuals in terms of having come, but in terms of the names, if a name keep on being repeated, we just keep it as that, because then that confirms that there is a number of people that are confirming a common name. But when you come, even though your other family members come, we have to register you so that we can keep track of everyone who would have come forth for a particular body, that in future we're able to then cross-reference and also be able to be in touch with those that we need to be in touch with. Right. So currently that process will be resuming as well today.
Okay, so that's good to get an update on the number of post-mortems that have been completed. All 77 have now been completed. Another update perhaps that you can give us this morning is the number of the number of people who have been able to claim the remains of their loved ones. The last figure that we have was that 7 bodies have been released to families. Has that number changed?
No, the number still remains the number is about 10 from the 12 unidentifiable bodies. So I will see this week, expecting that this week, as soon as for the other 2 bodies, we can have positive IDs and also family members coming through so that the verification can take place. Hopefully those will also be claimed, but 10 out of the 12 identifiable bodies have already been claimed and collected by 7 of them collected. So we're expecting that from the 10 that have been positively ID'd, that the remaining 3, the families probably from their side, they are making some arrangements in terms of being able to collect those particular bodies.
Yeah. The other issue, Motalatale, is the issue around identity documents and passports, because for a family to claim the remains of their loved ones, that's the kind of identification that they need, right? And that might pose quite a bit of difficulty if that family is among the survivors of the Marshalltown fire, because we know that people there lost all of their belongings, and in many cases that included their identity documents. How are we getting around that?
Well, I think the fact that already we have 10 families that have positively ID'd their loved ones, it tells you that the system is working and there are means that are allowing for that to happen. Remember that if you are properly registered, obviously, and your documents are lost, they were working closely with embassies for, if we've got foreign nationals, for the embassies to be able to assist in terms of issuing letters of confirmation there. But we're also working closely with the Department of Home Affairs, which, by the way, has also been sent officials to operate from the Deep Kloof Forensic Pathology Services to be able to assist families, because that's a process that is not handled by the Department of Health, but is handled by other sister departments. So they are on site, they are assisting with that particular process. In terms of, normally whenever we have this kind of situations, there are requirements that you need to be able to produce. One of them is that if you don't have any identification documents and so forth, you would either, if you were already on the system, Home Affairs would be able to reissue you with documents to allow the families to process. But in the case where I'm not registered, I'm not known even on the Home Affairs system, obviously if I come from a different country, the embassy there will also come in to be able to assist with verifying, because they are able to check even back home in terms of confirming the status of the particular person. And once those confirmation processes have taken place, then it allows, because for us to say, to hand over a particular body to a family, there needs to be a positive identification that takes place, and that identification is accompanied by certain documentation. But we are working with multiple stakeholders, including the countries of origin where some of the people might be coming from, so that we were able to then expedite the process. In fact, you would have seen that on study when we gave an update, some of the embassies had already started coming. They've gone to the Deep Kloof Forensic Pathology mortuary to actually look at how they can assist from their side in terms of the process of processing some of the documentations, and also assisting with being in touch with some of the families back home.
And then, you mentioned the issue of antemortem swabbing, which will now need to take place, right, to try and link families with the remains of their loved ones. What do you reckon the timeframes will be involved here, given the kind of backlogs that we know exist in DNA testing in our country?
Look, like we said, swabbing has already taken place, and I think that's a process that the SAPS is managing. And I think they have indicated that at the moment they are not really sitting with backlogs from their side. Yes, there were backlogs in the recent past, but I think the team from that side have been working hard to actually ensure that the situation stabilizes, and I think they've given an assurance that they've dedicated some teams to be able to work on this, and the issue of DNA testings and so forth should not be an issue. I think even the fact that they've been able to complete the samplings so quickly shows that there is that commitment to actually fast track the process. It's not something that from where we're sitting, we're in control of, obviously, because it's dependent on other agencies of government, but we are working collaboratively, and there is that assurance that the team will try and expedite the process as much as possible. Of course, even after the DNA samples have been taken, you still are dependent on it's like one half of the puzzle. The other half of the puzzle is that you need an actual close relative, a child, a sibling, a mother, a father, to be able to present, so that you can then cross-reference. Without that other half, the process will remain incomplete, even though other processes have already been done at this stage.
Yeah. Motalatale, let me thank you for your time this morning. The Head of Communications at Gauteng Health, Motalatale Modiba, joining us for an update on Marshalltown fire victims and where that process is on this Monday morning.